health is one of our primary research area. In this area we are focused in signal processing, developing algorithms for image, video and audio processing in order to create software for helping diagnosis in otolaryngology, dermatology, radiology and oncology. At present, we have 6 main research areas: neuropsychology, dermatology, oncology, otolaryngology, neurophysiology, EEG, and fMRI radiology. Otolaryngology. We have made an application for diagnosis, analysis and monitoring of patients with vocal pathologies. On the same system, we have an objective evaluation of both voice and image anamnesis or information of the patient gained by asking specific questions, and subjective evaluation of the ORL. Dermatology. This system helps dermatologists to deliver a fast and non-invasive diagnosis. Thus, it helps preventing skin cancer and treat it in its early stages, because patients will be more comfortable when tracking their lesions. In the diagnosis of melanoma using dermoscopy, there are many algorithms used in common medical practice. The main ones being the ABCD rule, the Menzies method, the 7-point checklist and pattern analysis. fMRI radiology. Functional magnetic resonance imaging or functional MRI, fMRI, is a type of specialized MRI scan used to measure the hemodynamic response, change in blood flow, related to neural activity in the brain or spinal cord of humans or other animals. When neural cells are active, they increase their consumption of energy from glucose and switch to less energetically effective, but more rapid anaerobic glycolysis. The local response to this energy utilization is to increase blood flow to regions of increased neural activity, which occurs after a delay of approximately 1 to 2 seconds. This hemodynamic response rises to a peak over 4 to 6 seconds before falling back to baseline, and typically undershooting slightly. This leads to changes in local cerebral blood volume and local changes in the local concentration of oxyhemoglobin that are detectable through their paramagnetic effects. Neuropsychology, EEG. We have developed a system to improve the quality of life for people with severe physical disabilities, such as double congenital orthosis, providing a tool for an augmentative communication system. This means that a non-speaker person will be provided with an effective way of communication to become an active communicator. For this purpose, we have used a technology called BCI, Brain-Computer Interface. The BCI technology is a communication system between the brain and other devices such as a computer. This technology translates the brain activity into commands for these devices. The event-related potentials, ERPs, are a non-invasive method to measure the brain activity during the cognitive processing. They are a transitory electric fields, and they appear in a determinate time span once the stimulus, an image, a sound, etc. Neuropsychology. Asperger disorder is an autism spectrum disorder that is characterized by significant difficulties in social interaction, along with restricted and repetitive patterns of behavior and interests. It differs from other autism spectrum disorders by its relative preservation of linguistic and cognitive development, although not required for diagnosis. Physical clumsiness and atypical use of language are frequently reported. The system prompts the user for everyday situations by giving 3 answers, which only one is valid. If the user doesn't choose the right one, the system displays a message with a series of tips and explanations.